Hi there, and welcome to Canceling COVID. It's your safe space for reliable information to safely navigate this pandemic. I'm Tanya Rivens, and today, boy, I'm excited. We're talking about a COVID controversy. What would you say if more governors lifted mask mandates? Well, it's happening in Iowa and it's creating a lot of concern. We'll talk about that in a few. But in the meantime, jump in the chat and answer our question, the question of the day. What would you say if more governors lifted mask mandates? Oh, I'd love to know how you feel about that. Now to our top story. There's a huge push from North Carolina Governor Roy Cooper to get the state vaccinated quickly and equitably. The governor now is addressing the reluctancy in the Black community to get the vaccine, saying that only 18% of vaccines administered in the state have gone to the African American community. That's less than 20%. Now, to up those numbers, the governor is now setting aside a portion of the state's weekly vaccine allotment to service clinics and vaccination events in minority neighborhoods. In addition to that, some of the community groups that serve our community are looking forward to the opportunity to provide this to those that are lacking or missing out. Now, the COVID-19 pandemic only highlights the severe inequity in healthcare for African Americans. And that's where I bring in our very first guest is the distinguished Dr. Yele Aluko. He's the Chief Medical Officer for EY Americas and pushes for health equality. And good afternoon, Dr. Aluko, and thank you so much for taking the time to join us.
Thank you for the invitation and good afternoon to you, Ms. Rivens.
And what's really appreciated is that, as busy as you are and you serve so dearly here in our community, just helping just any and everyone. I have to give you your kudos and props. I share this with everyone when my mom had heart surgery and totally off the topic, but I think that you give people their flowers. I reached out for who's the best in the business and who can I talk to. And of course, it was you. And you stopped by and talked to us and helped us feel really a lot more comfortable with the decision that we were making. So I want to thank you for that and just thank you for always being there for those in the community.
Well, thank you for your kind words.
Absolutely. So let's talk about EY Americas and health inequality. You're renowned, you have a renowned track record as a physician, your work showing how COVID affects people of color, more specifically, our vaccination and testing rates. The issue of health disparities often comes up in your speeches and blogs. What would you say are the top disparities in your opinion, and how are they contributing or attributed to the COVID response?
Oh, that's an excellent question. Top disparities is somewhat difficult to codify because these disparities abound. You throw a dot in any direction, and within any disease context, then minorities in general, and African Americans in particular, are more exposed to disparities. But the big buckets, if you would ask for them, would be heart disease, cancer, diabetes, and of course, COVID. But then, of course, there's also areas like infant mortality. African American kids, Latinx kids have more mortalities in infants. And the same applies to maternal mortality. And this observation is even seen in African American women who have college degrees, oftentimes have more adverse outcomes from pregnancy. And then there's also the disparities within the system when you encounter providers. This is not universal, but it can't be ignored that there continues to be systemic bias that sometimes impacts decision-making and recommendations for appropriate treatment. So like I said, the disparities are pervasive and they're all over the place. I didn't mention HIV is another one.
And we just honored Black HIV/AIDS Awareness Day this past Sunday. And when you were talking about maternal, it's great to start hearing more conversation about that. You can't help but, for me, think about, the great tennis player, Serena Williams, and how when she was having her child and she had to tell her doctor, what to do because she was familiar with. And but who on that level, unless you're on that level, would even have any idea, to have to tell your doctor this is what I need. And that was simply because she's a professional athlete and she knew what was necessary. So we're starting to hear more conversation about it, but what would you say needs to happen to kind of layer or maybe even the playing field, or is that even possible?
So evening the playing field suggests that we are talking about health equity. When you understand that in the history of the United States, there has never been societal equity. So that being said, health equity is an aspirational journey. It is the true north which we hope to get to at some point in time. Health disparities have existed since the history of medicine in the United States. That goes back centuries. So we need to understand that it's a very complex ecosystem that drives these inequities.
Mm-hmm.
And it starts within the context into which people are born, what kind of conditions people are born into, what kind of support systems they have, what type of family environment they have, what type of opportunities for education that drives health literacy and financial literacy, what opportunities exist for upward mobility, what type of housing opportunities or challenges do you have, and is there access to the right types of food? So I know you've heard about the social determinants of health. What I've
Yes.
just mentioned speaks to those social determinants of health that impact the vulnerability for a person to develop disease even before it becomes evident.
Hmm.
Minorities tend to be more exposed to adverse social determinants of health, and therefore they begin to brew diseases within their bodies before they actually become manifest. So
Ooh.
these are the external factors. And we need to understand that these external factors didn't just happen. They have been put in place deliberately over generations, something I refer to as the political determinants of social inequity. Those have driven the social determinants of health that result in health disparities. There are also internal factors, and these internal factors are those that are internal to the health industry, within the bricks and mortar of physicians' offices, hospital systems, and so on and so forth, where access to care is problematic for the reasons that I have mentioned. And even when you do get care, your diagnosis may be at a later stage at the time you present as compared to a same aged Caucasian person, same age, same sex, more advanced disease, and worse outcome. And
So,
then
Doctor.
again, there may be differences in treatment recommendations
Hmm.
and also difficulties maintaining chronic care management once you leave the hospital so that you don't revolve back and forth between home and hospital. A lot of factors, very complicated.
It is, Dr. Aluko, and you've taken this on, and there are so many layers. And for one to even hear this conversation, and it's like, where do you start? How do you wrap your arms around this? And is there any possible chance of getting all this, kind of even close to being balanced?
Well, I think the solution begins with a broad societal awareness and acceptance. And I've
Okay.
been a student of health disparities and racism in medicine for more than 25 years. And for the first time, I feel that the focus now is less about the problem and talking about the problem and publishing scientific journals about it. But the conversation now seems to have developed a groundswell of moral and societal support from big business, policymakers, and stakeholders within the health industry and society in general that this needs to stop. And we're now focusing on solutioning in a very strategic manner to look at how the social determinants of health can be modified, and shining a lens also on the outcomes of processes and clinical decision making that happens within health systems.
Well, for anyone just hopping on, and we see some people that are joining us, don't forget the question of the day. What if more governors lifted the mask mandate? We're talking to the distinguished Dr. Yele Aluko, and very well known here in our community. Well, just not, locally, nationally, and worldwide as far as your reputation. And we're honored to have you here. Let's talk about EY Americas a little bit. Maybe explain what its purpose is, and then how it helps clients develop and follow return to work strategies to maintain safety, and just kind of talk about advice for the frontline workers as we continue, because we know that's also our community or minorities.
Happy to do so. So EY, Ernst and Young, is a global company, as you know. It's about 250 to 300,000 employees across the world. And I am working in the Americas portfolio of our business. And we provide solutions and advice to clients across all industries. So I'm in the health sector. So the clients that I work with primarily are within the health sector, hospital systems, large physician groups, and also insurance companies, medical device companies, and big pharma. Now, with COVID, I also am doing a fair amount of work across sectors within multiple industry verticals and multiple businesses within different industries, such as retail, marketing, tourism, manufacturing, transportation. Because with COVID, all businesses are now realizing that they need to be a little more insightful, in fact, a lot more insightful about the health of their employees. And
Yes.
they've all been asking the same questions. When COVID began, when is this going to end? How do
Yeah.
we keep our people safe?
Right.
What do we need to do to keep our workplace safe? Are we going to have to reconfigure our physical assets with social distancing? How do we monitor our people when they come back to work? Should we be doing diagnostic testing? If so, what type of testing? How frequently? And how much is going to cost us? So we've gone through those conversations, and at EY, we provide that insight to clients. We have delivered some innovative solutions around diagnostic testing and workplace safety. The workplace of the future is going to be a different type of architecture. So we provide that type of insight as well. Now we're dealing with pandemic fatigue and the need to continue to be disciplined around wearing masks, social distancing, and personal hygiene. That messaging must continue to be reiterated, and we advise our clients to cascade that messaging downstream to their employees in the trenches. We're talking about vaccines that are now in place. And
Yes.
with vaccines, there's a whole lot of consternation because of mixed messaging around efficacy, as well as we are aware that there's a segment of the population that are referred to as anti-vaxxers.
Yes.
And there's also the reality of vaccine hesitancy that is most prevalent within minority communities. So we have a lot to talk about, all things COVID.
Camera has frozen up. We deal with that. He's moving more a little bit now. Hopefully, it's not on my end, but boy, is he sharing some really good stuff. Dr. Yele Aluko with EY Americas. And if you get an opportunity, we'll get his email back up again so you can reach out to him and just share some information. Dr. Aluko, looks like you're back now. I know your screen froze a little bit. Are you still there?
I'm here.
Yeah, yeah. I'm going to wrap things up with you, though. I really appreciate all that you are sharing. 10 minutes is just not enough time. We applaud, and we're very fortunate to have you here in our community. I've got your email up, yele.aluko@ey.com. As we wrap things up, is there anything else you would like to share? You were kind of talking about the workplace, which is great, as the vaccination piece is there. And I know We're talking about across the country pretty much about returning our educators back to the classroom, and there seems to be concern about whether they should be vaccinated first or not. So, as we wrap things up, is there anything else you would like to share?
Well, yes, maybe a couple of things quickly. First of all, this is February 2021. Uh,
Yes.
we need to have resiliency and be prepared to be in this context probably till the end of 2021. If it happens earlier, then that's a bonus. But we need to be disciplined. Even though vaccines are here, we cannot let down our guard. Social distancing, masking, personal hygiene can't be overemphasized. Secondly, vaccines are important, but we need to understand vaccines are most important in the context of them being able to deliver herd immunity. And that means 80% of people we are projecting will need to be vaccinated to get herd immunity, whereby we can bring an end to the pandemic, not an end to coronavirus infections, but an end to the pandemic so that we can begin to resume our normal lives. It's important to know that because there's about 13, 14% of our population is African American, about 18% is Latino. So you got 32% of people who we need to very deliberately educate about the end goal of herd immunity. About 22% of our population is under the age of 18, Black and white. We need to ensure that they are getting vaccinated as well when they get approved. So the vaccine hesitancy is real. We understand the origins of it. We need to advocate for the science and the safety of the vaccine so our people of all races can get the benefit of vaccines.
Great, great stuff. Dr. Yele Aluko of EY Americas and one of the most prominent physicians that we have here in the city, working really hard. We've got some great people on the job, folks. We just need to get educated, take advantage of their knowledge and wisdom, and follow through. And what a great conversation. We'll get his email back up for you in just a moment if you would like to reach out to him and share these resources. I mean, we are trying to work together. It's about canceling COVID, cannot do it alone. Again, that's yele.aluko at ey.com. It's kind of fun seeing his name too, just rolling off your tongue. And what a great guy, him and his beautiful wife, just servants, helping others in the community. Now let's turn to a growing effort to address the overwhelming spread of COVID in the Black and Hispanic community. We've got the question of the day. What would you say if more governors lifted mask mandates? I see you hopping on the G-Man, Anna Louise Pryor Gates, along with Frederick Love. Chime in and share your response to this. What would you say if more governors lifted mask mandates? We're going to bring in another guest now as we talk about the overwhelming spread of COVID in the Black and Hispanic community. She was on with us last week, dropping some really good knowledge as well. We're talking about Dr. Trasha Black of Genesis Project and Groundwater Solutions. And she is working really hard, heading up an initiative to get our people tested for COVID. And we're grateful for that. So, Dr. Black, welcome back to the show. And we're going to make this a weekly segment because we need to hear from you. We need this information. And let's talk about last week you were talking about regular testing and kind of expand on that a little bit more about what you would consider regular testing.
So I would consider, and thank you for having me back on the show. But
Yeah.
regular testing is testing at least once a month. Um, Folks who are having direct contact with the public, really every 2 weeks, they need to be tested. I was talking to my daughter, I think last week, and she works two jobs. She works at Panera Bread and she works at Harris Teeter. And she said, well, we haven't had any problems at work at Harris Teeter with COVID, but we've had some issues at Panera Bread. And I said, well, what were the issues? She said people came up and, we found out they were positive. We don't know, they don't tell us who was positive, just that one of the employees was positive. She said, but there's nobody positive at Harris Teeter. I said, well, does Harris Teeter test employees? And she said, no, Panera Bread doesn't test either. And so it's like Dr. Yele was saying, can't say the last name, and I'm so sorry for that. But You got to work with the businesses and the workplaces, because just because nobody's showing up saying they're positive doesn't mean they're not. A large portion of folks are walking around infected with COVID-19 and they do not know it. And the challenge is they may feel great. They have no symptoms, which is not abnormal, but they are spreading it to people who could have life-threatening effects from COVID-19. So the testing is to keep everybody safe so that we actually know who's positive, who's not. We know when we need to quarantine or isolate, as opposed to, being out there in the community. Most of the people that I call who are positive, we do testing every day of the week, except Sundays, unless we get a special request. But most of the people I call, they did not know that they had been in contact with someone who was COVID positive, and they did not have any significant symptoms. And so they are spreading it around. So for us to expect people just to be coming forward without the knowledge of the testing is just not going to happen. That's why it's continuing to spread.
So
In
what
addition,
does Dr. Black, what does regular testing look like to you? Is that once a week, once every 2 weeks?
once every 2 weeks would be ideal, but no less than once a month. Folks are getting tested. And then when they know that they have been around someone who has tested positive, then going to get tested again themselves.
Well, I
Uh,
said for a long time, and going back to what your daughter is saying, a lot of the issues, and Dr. Luco, it's great to see their group working on this. I feel like a lot of us, just regular people, are trying the physical distancing and mask and the personal hygiene, as he referred to. I like that better than just
mhm,
your hand
mhm,
sanitizer. I think a lot of the problems do lie in the workplace that
mhm.
right now, because they are looking at their bottom line, and all these additional measures, certainly doesn't help their return of investment and their profit margin. And so sometimes they're kind of skimming and looking the other way. So how do we implement? You've already started a pretty good method of doing testing around the state. How are people able to kind of implement what you're sharing?
They just need to start, mark their calendars. It's the beginning of the month. My staff, they have to let HR know and show verification that they've been tested. So just start looking at their calendars and marking those dates. When the month starts, plan, when am I going to get tested? If you're in a place where you need to make an appointment, go ahead and make your appointment to get tested, or find organizations like ours who are around the state where you don't need an appointment and you can just drive up to be tested.
What
But
about
plan.
insurance? What about insurance if they're trying to get tested?
No insurance is required. And
So
even if you have insurance, there is never an out-of-pocket cost for COVID testing.
So, Dr. Black, tell us how your system works. You mentioned call you all to kind of walk us through how that works. If I want to be tested, do I need to call, make an appointment? Do I just find out where you're located?
You just find out where we're located. You'll start seeing that on our website and social media. Right now, we use flyers. We have a website where you can go on and register to be tested. That website is www.ground-water. Actually, let me start over.
That's all right.
www.groundwater-solutions.org. Okay,
Okay.
groundwater
Groundwater-solutions.org.
solutions.org. They can go there and they can pre-register to be tested, or if they come to one of our sites, they just drive up. Our sites are mobile sites are all drive up. They do not need an appointment. Right now, once they show up, we do use paper registration, but starting next week, it will all be automated. So I'm so excited that
Yay.
we've got the resources, and
Good.
we'll have tablets. They will, if they want to register, we'll give them a link that they could send to their phone, like one of those, you text register to this
Right.
number. I just don't know what that number is yet, but they'll
That's
be able to text that number, the word register, and they'll automatically be taken to the registration site, can do everything on their cell phones, and then just drive up. We'll print a label and they go up to get tested. Right now, they do basically the same thing, except they have to fill out paperwork. We fill out a registration form and a laboratory form, and then they move forward and they're tested. Typically, folks get through our lines in about 10 to 15 minutes, depending on the traffic, but it's a
how
quick
long
process.
how long for the results to come back?
We are typically getting the results back the next day,
Ooh.
sometimes the same day. Mhm.
That's great because that's been that early on, especially around the holidays. I tell the story because it was right before Christmas, and my son found out someone on his team, and we all
Mhm.
thought we'd been infected. And the individual came in our home, and it took like 4 or 5 days to
Yeah.
get the results back. And clearly, the one I've had someone on, it said LabCorp was the one lab that everyone was using. Looks like that has now changed, and that's encouraging if that's the case.
Mhm, mhm. I think that was they were bombarded. There were times where folks were waiting over 7 days to get
Ooh,
their results back. And I think it was just the nature of the newness and new processes. But I think laboratories in general are getting better.
uh-huh.
We have our own in-house laboratory now, so we're able to process samples the day that they come in, typically.
So now tell us some of your upcoming locations. If people, do you have your calendar where we can invite people now?
We
If they,
do. I can tell you where we are this week.
yeah.
Hold on 1 second.
And that way people can go ahead and we're talking with Dr. Black. We're going to, I'm glad that she's partnering with us. And that's how important it is, folks. I'm starting to meet more people that are involved and we're all connecting because our heart is to serve you, to serve the community and to get rid of COVID. And we can do it. We're pulling on resources. One of the things I loved about Dr. Black is, she with a group of professionals pitched to the governor, let us talk to us about some of the steps that need to be taken and they've started to implement them. And I really, really appreciate that. So you've got some testings that are
Mhm.
you're completely full, I guess, for the rest of the year where people, there's no reason to say I don't know where to go.
Exactly. And if there are locations who want to host testing around the state, they can call us as well. We have pastors who are calling to say, come and test my congregation.
Wow.
And so if you want to be a host for testing, there's no reason not to contact us or another organization to get testing into your community. And we do know that there's still communities out there that don't have testing. I'll tell you where we are this week.
Okay.
Today, we are at Master Cuts at 1610 Ashley Road until 3 p.m. We are also at St. Luke Baptist Church, located at 410 Hawkins Town Road in Salisbury, North Carolina.
Okay.
Tomorrow, we will be in Forsyth County and Winston-Salem. We'll also be in Laurinburg, North Carolina, and in Rocky Mount, North Carolina.
So you can see all around the state there, no excuse, folks. We're all on Facebook. Share this information, groundwater-solutions.org, a full calendar. And again, we've got Dr. Black on. Thank you so much for all that you're doing. We're wrapping up here. Is there anything else you would like to share?
Yeah, I just want to piggyback off Dr. Aloko. Am I saying it
Yeah,
correctly?
Aluko. Yeah,
Okay. Face coverings are so important. I want to address the question that you asked about governors lifting that
thank you.
requirement. That's almost a death sentence for lots of individuals, and we have lost so many people. The face covering is one of the major ways that we keep ourselves COVID safe. And when I say face coverings, I'm not even just talking about masks. Your eyes, your ears are susceptible. So when you see those folks with the shields on, those
Uh-huh.
are what I recommend. The hygiene, of course, is very important, and stay at home. I know that we want to be social beings. I know that that's important. We have to be connected, but if you don't have to go somewhere, just stay home. If it's
Uh,
not an urgent issue, just stay home. That is the way that we're going to keep ourselves safe. Educate our young people as well. We need some big mamas and some grandpas to talk to those young people, teenagers, because it is so, so very important. They think COVID, is a conspiracy. It may not be real. If they're immortal and it's not going to hurt them, but they are spreading to their families.
and it's causing lives in our community. And Dr. Black,
We
thank
can
you so
stop.
much. Yeah, it's causing lives in our community, and that's the sad part, the down part, especially when you got generations in the household. So thank you so much. We're honored. Thank you for supporting this, canceling COVID, and that just speaks again to your heart to serve. So we'll talk with you again next week. Yeah, that's the information. We'll keep uplifting it as well. Dr. Black of Genesis Project One or Genesis Project Groundwater Solutions, the website, Groundwater Solutions groundwater-solutions. That's it, groundwater-solutions.com. Come on, folks, let's get the word out that they are testing all around the state. So Still looking for your comments about the mask mandates being lifted up, and Dr. Black kind of chimed in on that. Now you're being encouraged to kind of double mask, and you go, here we go. But it's not a bad idea to just double mask where you're out. She even talked about covering, face covering. So, that's something to consider as well. One sad part, it was announced here in our state, we've unfortunately reached, if I read that correctly, the 100,000 death of our citizens in North Carolina. So, what we're sharing is real. Whether you believe it's a conspiracy or whatever the case may be, the results are there. It's, we're all being impacted by it, and we need to take steps to cancel COVID. I'm going to wrap things up. Of course, coming up on Friday at 1 o'clock, we're talking mental health and your mental fitness. And we've got some really great guests that are going to join us. Tracy is going to be here, Tracy Austin, and she is one of the most positive, powerful mental health experts that I've ever encountered. In addition to that, we've got someone who has lost nine family members and still holding it together. So we're going to have all that on Friday. Keep chiming in with the question of the day. I'd love to see your answers, love to see your response. Again, what would you say if other governors started lifting the mask mandate? You heard Dr. Black say it's pretty much a death sentence, and we are the ones that are dying. I'm going to wrap things up, folks. What a great conversation. Thank you to Dr. Black. Thank you to Dr. Aluko. And of course, as always, life's challenges make you better, not bitter. I'm Tanya Rivens. Thank you for joining us for Canceling COVID. We'll see you back here on Friday, 1 p.m. Have a great day.